Thank you. This is special for me because not only did I sponsor the resolution, I want to say along with Representative Trey Pardee, as the prime sponsor in the House of Representatives. But this whole thing, I call it a true Delaware success story because as of 2012, the DHIN became self-sustaining. It operates on the fees that it charges for its services, and there's no separate appropriation in the bond bill or in the budget bill or from the federal government.
The most contentious and difficult issue of the whole thing, really.
Yeah.
Senator Carper.
Thank you. There's an old saying that success has many fathers, failures an orphan. Success also has many mothers are here today. I just want to thank the Governor, I want to thank Senator Bushwaller for being a part of this, and to Trey for sponsoring the legislation. When I signed in 1997 legislation called for creating the Delaware Health Information Network, I really did not fully understand what it would become. And I don't know, it was Bettina Twerdy with Delaware. She was encouraging me to sign it and told me what it was all about, Roger. And I said, oh, that sounds good. Let's do that. We were in High Cotton. John was our Secretary of Finance there. And, Brian was our legislative liaison, about to become our Secretary of Public Safety. And we were on a roll. And so sure, I'll sign that. And I don't know if I signed it here, but anyway, we have something in Delaware called the Delaware Way, as you all know. And I like to say that there are 4 C's, letter C, which really represents, reflects the Delaware Way. Communicate, compromise, collaborate, and civility. Communicate, compromise, collaborate, and civility. And the DHIN actually reflects those values, the idea of communicating, collaborating, in order to get better healthcare results than we otherwise would. I just want to say to Dr. Lee, Janet, and the team, some of whom are here today, how proud we are of you. There's a lot of things that Delaware could be proud of, and kind of showing the way, like starting a country. And when people say to me, well, what is Delaware famous for? People from other places around the country, I say, well, we started the country. And they say, anything else? And I say, well, the DHIN. Oh, okay.
I came in on the aftermath of the 2010 stuff. And so it was pretty clear to me that we had work to do to establish a reputation and to truly be that self-sustaining entity that had been envisioned. And we truly could not, would not be as successful as we are right now without specifically Christiana's support, but truly all of our data centers and our private stakeholders who recognize the value that DHIN brings and are willing to pay to keep it running. I am grateful for the insight and the foresight of our legislators in Delaware who recognized we've already got an important asset in the DHIN. We've got a governance structure that represents the broad range of stakeholders. We have people who are trained in managing data, following all of the HIPAA requirements, who are trained in being able to combine data from disparate sources and match them so that you know you've got this data representing the same person. And so we've got just a tremendous opportunity now to take this to levels that are even greater than where we've been.
So I've been very lucky to be part of an organization for the last 7 years that has been built on the strength of all of that hard work that you have done. And during Jan's tenure and her amazing team, this entity has delivered and now created a portfolio of nearly 20 unique services that go beyond that initial concept of results delivery, of electronic results delivery. So now the ability to do things like take an accountable care organization that is managing a population of patients and to actually be able to surveil when those patients are engaged in care delivery, where historically organizations would have been blind to that care. We now can see that a patient may have been admitted to the hospital at the beach, and minutes later a care team is alerted to that and can engage with that patient to help navigate them to the right resources and get them on the right course for recovery, rather than just letting patients navigate their own patient pilgrimage. And at Christiana, we built a tool around that called Christiana Care Link that ingests this data from the DHIN in a real-time fashion, to be able to do that, to be able to care for populations in a way that healthcare has never been able to do that. Delaware is by far in front of all the other HIEs that are still struggling with sort of just basic enlightenment for people to understand the value.
And when you describe the fact that we have both those sets of data and the ability, as we think about moving to a reimbursement system based more on quality and output, these tools are going to be incredibly important. And as you think about all the challenges that we've overcome over the years. And it says, on behalf of Delawareans across the first state, Governor Carney and Lieutenant Governor Hall long recognize the Delaware Health Information Network for its long-lasting impact on healthcare delivery in our state. The DHIN began as a public-private partnership in 1997 and has grown significantly since then, currently operating independently and without government financial support. Yay, yay, yay. It then continues to help the state of Delaware improve efficiency in the delivery of healthcare services and access to healthcare data. The DHIN is recognized nationally as a model for organizations of its kind and serves the state of Delaware honorably in the field of health information technology. This tribute brings with it sincere gratitude for the DHIN's contributions to the state of Delaware and appreciation of its commitment to improve access to healthcare information. Presented on this 23rd day of April 2018 by order of the governor and signed by myself and our Lieutenant Governor, Bethany Hall.